If you've recently had a concussion, here are 4 signs that you might be dealing with something more serious. I'm going to skip more obvious things like prolonged loss of consciousness or seizures. I'm going to talk about some subtle things that give you a clue that you should probably go visit the ER if you're having any of these signs. The first is something called anisocoria, which is basically an asymmetry of your pupil sizes. So if you notice that one pupil is abnormally larger than the other pupil, then it could be a sign of an intracranial bleed, like a subdural hematoma, that could be compressing brain tissue and affecting the cranial nerves, causing that eye to look a little bit bigger. And you want to compare this to what your normal baseline is, because some people do have a pupil size that's a little bit larger than the other, and that's something that they've had since childhood or from birth. The second is if you have abnormal bruising underneath the eyes or behind the ears. This is called raccoon sign, and this is called battle sign. And this is a sign of a basilar fracture. This is especially important is if you hit your head in a different spot not related to the places where the bruises are occurring. So that's an even more insidious sign that a fracture has likely occurred. Number 3 is a little bit challenging because some people think they have a runny nose. But if you have a clear fluid that is leaking from the nose or the ears and it's dripping like a faucet and not like the standard runny nose where it's a little bit more sluggish, that could be a sign of a CSF leak, also from a basilar fracture. So headaches are super common after a concussion. Almost everyone with a concussion is going to have a headache of some sort. But if you have a headache that is progressively getting worse hour after hour, day after day, it could be one of those signs of a subdural hematoma growing inside of the brain and compressing some of that brain tissue against the meninges, causing a worsening headache. Concussions are a serious enough injury as it is, so even if you've already been to the ER and they said you already diagnosed you with concussion to go home and recover on its natural course, if these signs start to show up, especially later after the fact, it's important to go get reevaluated again, because this could be a sign of something that is starting to emerge that could be a more serious threat to your brain than the concussion itself.